Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. It's a webinar where we get to talk about Lyme disease, where I get to talk about it. And I guess you get to ask questions, and hopefully I have some answers that you'll find helpful. So for those of you that are new here, welcome. I'm glad to see some new names on my message board this evening. You can participate in the webinar by either listening to the responses I give to the questions as I answer them, or you can write questions to me too. And where you can write your questions to me is over on the right-hand side of the screen at the bottom is a chat box. And you can write your question to me there. A couple things about that. Number one, short questions work best. If they get really too long, I can't post them, and they get very difficult for people to follow, okay? Secondly, as you're writing your question, only hit the enter key when the whole question is complete. If you try to hit the enter key to create separate paragraphs, it creates separate questions, which make it hard for me to follow from my side of the screen, all right? I see a lot of familiar names showing up and people showing up here tonight. So I'm glad to see that, to see you all back again. And I'm glad to see you keep getting value out of this. For those of you that are participating, you do find these useful. One thing I'd ask you to do is to share what you're learning here with others. When I send out tomorrow morning, when I send out an email with a recording of tonight's webinar, feel free to share that with people you think might benefit, okay? And also when I send out the notice that you can sign up for the webinars, feel free to share that as well too. So tonight is the last webinar we're going to do this month. Next week, I will take a week off from doing the webinar. About every fourth week, I try to take a week off and not have this as an obligation for myself. So we'll be here with you tonight. In tomorrow morning's email, which will include a link to the recording of this webinar. Yes, I am creating another recording. Oh, that's Mr. Thor back there. He seems to be really liking that chair during the webinars lately. So that's my Basenji Thor. His sister Halo is under the desk here. But anyhow, you may see them wandering around during the webinar. Anyhow, so tomorrow morning you will get that an email with the recording of tonight's webinar. And also in that email will be a link that you can use to sign up for the June series of webinars that I'll wind up having. Okay, yeah, I think that's right. Let's see, next Thursday. Anyhow, I'll work it out. I may have the first week in June off on a webinar too. I have to see how the timing of this works out, but I believe the first week in June I will not be here as well. All right. So anyhow, without any further ado, let's go ahead and get started here. During the webinar, I will be reading the questions out loud, but for those of you that are participating in the live version, you're actually going to get to see the questions post up on your screen. In the recorded version, they don't show up, so I read them out loud as well too, okay? All right, so let's get started here. Hello, Brenda. Hello, Dr. Ross. What is your best treatment for mold and Lyme disease? What is the best probiotic to heal your gut? Thanks so much for all you do. Brenda, I wish I could answer that because I think each situation that a person finds themselves in may require a slightly different treatment. So I'm not going to be able to answer that for you because there is no one best. There are many different best. So unfortunately, if you are looking, though, for some guide about how I usually start treatments and what I do, there's a couple things you could take a look at. So let me do a quick screen share here. All right, so this is my Lyme disease information site, Treat Lyme by Marty Ross MD. For my basic approach, where I start with my Lyme treatment, take a look at the Ross Lyme Support Protocol. And what you'll see down here is I do talk about this part here. I say before treating Lyme disease, make sure it's not mold toxin illness. And I talk about steps you can take to look at that. Click on this link here called Mold and Lyme Toxin Illness, where you'll see the various recommendations on how to treat your mold toxin illness based on what the actual mold toxins are. Okay, all right. And then in terms of the steps you should take to treat Lyme disease, I've broken them into different parts. You can see them over here on this side. So part one is sleep, do diet, take things to control your cytokines, Be on herbs that support your body to deal with stress. That's what an adaptogen is. Correct hormonal problems if you have them. Be on a good multivitamin. Do some basic detox supports. Exercise if you can, although most people have a hard time at the beginning of a treatment. Treat yeast. And then down here in this section right here, Lyme infection treatment, which I'm going to go to next, I talk about an herbal approach, which is the Otoba barking cat's claw. And I also talk about some antibiotics to start with if you don't want to go herbal. And I mention them here. Okay. All right. So anyhow, these are some starting places that you could take a look at. Okay. All right. All right. Good luck to you, Brenda. Hello, Lynn. Let's see. Hi, Dr. Ross. I've been symptom-free from Lyme and Bartonella for more than a year and went off my herbal protocol for both infections about 7 weeks ago. I came down with a fever and sore throat this week, which is surprising because I've had very little contact with anyone and always outside and masked. I had another throat infection with an abscess about 14 months ago and have read that recurring throat infection can be a symptom of Bartonella. Questions. What is the likelihood that this is Bartonella? Number 2, could it also be Lyme? Number 3, can a throat culture be performed to determine this? There are white nodules on my throat. Would that be the thing to try to culture? And number 4, should I also get a culture for Candida since I took a lot of prescription antibiotics and have some of the signs in your yeast questionnaire? Okay, so typically when you get Lyme, the recurring throat problems that people have with Lyme is more throat pain, sometimes swollen lymph nodes with Bartonella. But when you get these problems, you don't get a high temperature. So the fact that you've got a temperature, I think you said 102 here. Well, you just said a fever. So typically, a recurring throat issues from Bartonella is not going to give you fever. Also, recurring throat issues from yeast is not going to give you a fever. And if Lyme should get active again, it's not going to get you a fever either. Okay, now you can get a high temperature with your initial Lyme, or if you've had a new tick bite, okay, you can get fever with that. But typically on relapse, you're not going to have a fever from it. I suspect probably what's going on here is you have a non-Lyme, non-Bartonella, non-tick-borne related sore throat problem. And even though you are masking and being very careful, there always is the possibility you can still get something, okay? You could get viruses that give you throat problems. You could get a strep throat, the bacteria strep throat you could still get. And so there's other things that I would look at besides considering if this is Lyme, Bartonella, or tick-borne infections from what you've described here, okay? In terms of throat, they can do a throat swab to see if you have a strep throat infection. Keep in mind that a lot of white infection or things that give you white areas in your throat are not always strep throat, nor are they always yeast, okay? But they could do a throat culture to see if it is strep throat. Again, white patches in the back of your throat could be from yeast, but again, yeast is not going to lead to temperatures like you're describing, okay? So I would consider this probably to be a viral or a bacterial that is non-Lyme related, all right? All right. Good luck to you, Lynn. You should see a physician to help you figure this out, basically, okay? All right. Hello, James. Hi, Dr. Ross. Can you take lumbar kinase with curcumin, grapefruit seed extract, and the herbal protocol for Bartonella and Lyme? How long do you need to be on lumbar kinase for herbal? I don't understand what you mean by your next word there. Herbal something to break up biofilms. All right, let's see. So first of all, can you take lumbar kinase with the curcumin, grapefruit seed extract, and herbal protocol for Lyme and Bartonella? Yeah, you can. The question is, do you need to? So if you're using my recommendation of using the Otoba and cat's claw to treat Lyme, the Otoba and cat's claw break apart 100% of biofilm. Okay, that's the one thing that's really nice about them, is that not only do they kill Lyme, the Lyme germs, they break apart the biofilm. Newer research is even showing that the cat's claw probably treats both growing as well as persister growth state of the germ as well too. So many of you may know there's this new discovery that came out about 4 years ago that says that the reason people's Lyme may be difficult to treat is that Lyme has growing forms and Lyme has persister forms. Persisters are hibernators, okay? So that's kind of started us all looking at what do we give for those persisters. Now, I want to clarify my terms. So persisters are not cyst forms of Lyme, okay? So let's talk about what Lyme looks like. Lyme has two different forms, what it looks like. There's two forms that it exists in, okay? There's spirochete, that's the corkscrew looking thing. There's also microscopic cyst forms of the germ, okay? That's what it looks like, okay? So it can either be spirochete or it can be cyst, and it can go back and forth. It morphs between different forms, okay? Now, these spirochetes and these cysts have a growing state and they have persister states, okay? So just to be clear about that, all right? So a lot of the research now has shown us that Lyme has these persisters, these hibernating forms. And you can think of the hibernating forms as basically slowing their metabolism way down and ignoring most of the antibiotics that we send at them. The prescription antibiotics, that is, at least. Okay, now what's interesting is some of the herbal antibiotics that we have historically used appear, based on some of the research coming out of Johns Hopkins over the last year, many of these things now appear to be helpful for the persister form of Lyme. So cat's claw is something that can treat persister Lyme. Okay, so just so you know that, okay? But, okay, so if you're treating Lyme and you use Otoba and cat's claw, you have coverage for persister and growing forms, you have coverage for spirochetes and cysts, and you've also got coverage for persisters, okay? So just so you know that, okay? Bartonella, on the other hand, does have biofilms, and in terms of whether lubrikinase is the best agent to treat those biofilms, I don't know. And the reason I don't know is no one's done research to show it, okay? What I can tell you is there has been research done this last year out of Johns Hopkins University that tells us that things like oregano, cinnamon, and clove oils are useful to treat growing and persister growth states of Bartonella, okay? In addition, those oils break apart biofilm, all right? So if you want to go after biofilm, in this kind of situation, I probably would not use the lubrikinase. On the Lyme side, using Otoba and cat's claw is going to be enough to break apart those biofilms, okay? And kill the growing forms and persister forms and spirochete and cysts, okay? You got yourself all covered there. On the Bartonella side, my preference these days is to have people do the Psittacoda and then add to it a combination product made by a company called Dr. Inspired Formulations, and that their product is called Liposomal Cinnamon, Clove, Oregano Essentials. Those oils are useful at breaking apart biofilm, and they kill persisters, and they kill growing forms of the germ, okay? So that would be my response. My response would be, don't use the lubrikinase, get something different, okay? And so anyhow, I hope that answers your question, okay? Good luck to you, James. Actually, let me just show you one thing here, because that is a mouthful that I just described. All right, so in terms of, here. Okay, so this is my supplement store that my patients use. Anyone can use. So people that aren't my patients order from here as well too, okay? So if you want to see the product that I just mentioned, that the cinnamon clove oregano product, take a look under the supplements tab. The company that manufactures that product is called Dr. Inspired Formulations. And this is the liposomal cinnamon, clove, and oregano essentials, okay? This is what I recommend. That's, again, useful for persister, biofilm, and growing forms of Bartonella. It actually can help with persister, persister, growing forms of Lyme, as well as Lyme biofilm as well too, according to the research that we're seeing out of Johns Hopkins. Okay, all right. All right, let's see here. It's like we got another one from James. Hello, James, again. I think you're the same James. See, thanks so much for these webinars. In the past webinar, you called Dr. Klinghart brilliant, but disagreed with some of his methods. I concur. I have researched Dr. Klinghart's methods and have trouble deciding which would be helpful or unhelpful to add as part of treating my chronic Lyme. It would help me to know what you think are some of the best ideas and some that are not so good. I would literally need to review things with the document in front of me or look at some of his ideas. I don't remember all of them off the top of my head, okay? I will say one that I just flat out disagree with him on is that Dr. Klinghart has been perpetuating this idea that everyone with Lyme has parasites where Lyme can live in them and the parasites get into your bloodstream, and that's what's keeping people sick. And there's no science behind that at all. There's nothing that supports that opinion that he has. And so I'm not a big treater of parasites. I will treat parasites that are intestinal parasites if I have reason to believe that somebody has an intestinal parasite infection. And so I would consider intestinal parasites if somebody has a lot of watery, crampy diarrhea, for instance. I might consider treating for intestinal parasites if I've got somebody that's not recovering and I know that they traveled internationally, and while they were in that international setting, they developed an acute diarrhea episode, for instance, because that could be from parasites. And so it could mean that they're chronically colonized in their intestines with those parasites. So in those situations, I might treat for chronic parasites. The other time I might treat for chronic parasites of the intestines. And again, I'm only talking intestinal parasites. I think this idea that is out there floating around the internet, perpetuated by Klinghart, that everyone has parasites in their bloodstream that's holding them back is garbage. I mean, there's just nothing that supports that, okay? But in terms of when I also might think about intestinal parasites, is if I've got somebody that's having a hard time getting better and they have lived with a chronic well water where they have well water, at times I might treat for intestinal parasites in those situations to see if that's the thing that's holding them back too, okay? So that's just one idea I can give you, but I can't just off the top of my head go through the list of what I think is brilliant and what is not brilliant with him. It was more just a general observation that I gave you last time, okay? All right. Thanks, James. Good luck to you. Hello, Jim. Let's see. Exhaling is causing me difficulty. It causes spasms and muscle tightening that causes me to jerk around. And when I exhale, there is pressure in my head. What infection causes this? Thank you. So, I mean, to give you the best answer, I would need to ask you a lot of questions, which obviously I can't do in this setting, but I'm going to give you one idea to consider, okay? But there could be other ideas as well, too, all right? So, when you have too many yeast living in your intestines, so to talk about your lungs, I'm starting down in your intestines first, okay? So when you have too many yeast living in your intestines, which sometimes does happen when you've been on antibiotics, even herbal and prescription antibiotics, or herbal can do it too, and prescription often can, or if you had a lot of antibiotics as a kid, or if you've had steroids before, or if you've had a lot of stress, it's possible you got too many yeast in your intestines, okay? If you develop too many yeast in your intestines, that creates reactions. One of those reactions is your immune system that lines the intestine. So 60 to 70% of your body's immune cells line the intestinal tract, okay? It's a huge immune organ, the intestines are, all right? And one of the things that happens if you have yeast in the intestines is some of the white blood cells that fight infections will see those yeast. They'll try to get rid of those yeast, and they'll manufacture chemicals called cytokines, okay? Now, many of you know from participating in my webinars over time, the main Lyme symptoms you have are actually due to too many cytokines, all right? So your Lyme symptoms, whenever you have Lyme germ in you, white blood cells manufacture chemicals called cytokines. those cytokines are designed to turn the immune system on to fight that infection. They also, those immune cells that line your intestines also will make cytokines to fight yeast. All right. Now, in situations where your immune system is having a hard time getting rid of a germ, like in yeast in the intestines and Lyme in the body, it will sometimes produce too many cytokines as it keeps trying harder and harder to get those germs under control. All right. Symptoms of cytokine excess are brain fog, fatigue, hurting all over, neurologic dysfunction, hormonal dysfunction, sleep disturbances. Did I just give you the Lyme symptoms? Yeah, that's because Lyme symptoms are actually excess cytokine symptoms, all right? And if you have too many yeast in your intestines, they also trigger excess cytokines, okay? So one problem with too many yeast is they make it look like your Lyme is a lot worse than what it actually is, okay? All right. Number two that can happen with too many yeast in the intestines is one of the kinds of immune cells that line your intestines are called mast cells. Now, inside mast cells are where some cytokines are made, okay? They can produce cytokines, but it's also where histamines are made. So sometimes our mast cells will see those yeast and have an allergic reaction to those yeast, releasing histamines. Those histamines then get into the bloodstream, go up to the lungs, and they can trigger an asthma-like reaction, okay? So this is the relationship, all right? Too many yeast can sometimes give you a lot of spasming and easy spasming in your chest air pipes up here. Even though it's from yeast down here, the chemicals, the histamines that get into your blood can trigger asthma-like spasm of your air pipe, okay? So I have seen in my practice where there's been people that have what seems like more of an asthma type spasm reaction when they breathe out or when they go exercising, and we clean out yeast in their intestines, often this is going to get better. All right. The other thing that can sometimes get better, sometimes what you'll see with people with chronic yeast overgrowth in the intestines is they'll have this recurrent sinus stuff going on, like postnasal drip, a lot of nasal congestion right up here. And if you get rid of yeast, this also clears up too, because all this stuff that goes on up there also is a histamine reaction, okay? So I want to be clear, I'm not talking that you have yeast throughout your body. The yeast are in the intestines, but you get a system-wide response, which is those histamines give you stuff going on up here and give you the bronchospasm here, okay? So you should, of one of the things that could be happening, and I need to ask you a lot more questions to figure out if something else is going on, but of one of the things that could be happening, I would investigate whether you might have too many yeast in your intestines, okay? And a starting place to look at is an article that I've written about, do you have too many yeast, all right? And in there's some tools you can use to figure out if you might have too many yeast. So let me just do a quick screen share for you. All right, so, all right, in my online Lyme guide, I think many of you are familiar with the site. You always click on this Q&A webinars to sign up, okay? But this is this section right here, the online Lyme guide is the meat and potatoes, bread and butter, asparagus, and avocado of this site. This is where you're going to find everything you need to know, okay, right here in this online Lyme guide, all right? So take a look at this section on yeast. And there's two things I would look at. Take a look at this one called A Silent Problem is Yeast. It's where I describe and give you some tools to figure out if you have too many yeast, okay? And if you do, and you're looking at how do you get rid of too many yeast, then take a look at this article over here called Kills Yeast, a Brief Guide, okay? All right. Good luck to you, Jim. Hello, James. Let's see, does chronic Lyme affect copper levels? My serum and red blood cell levels are okay, but levels in several hair analysis are very low. What might cause this, and is there anything I should do about it? So, James, I don't find hair analysis to be that reliable, to be quite honest with you. So I'm not sure what it means if it's abnormal within your hair and it's normal within your blood. I'll start by saying that, all right? Secondly, I have not seen any scientific evidence that says that Lyme affects copper levels, all right? So anyhow, I hope that answers your question. Okay, good luck. Hello, Marie Eve. Let's see. Hi, Dr. Ross. My white blood cell level has been low for the past 13 years. Since 2008, since I've been sick with Lyme, recent value of 2.3. My MD here in Quebec, who doesn't know much about Lyme, always thought this low level was my personal normal level. And recently I saw a new Lyme doctor here, and she was a little shocked with this level and didn't want me to start an antibiotic treatment yet, but rather to boost my immune system and retest in a month. And also test for certain cancer markers. I panicked when I saw she asked for cancer markers on the request. Is it normal to have low white blood cells as low as mine after 15 years with untreated Lyme? And what can I do? What supplements would help? I heard zinc, vitamin C, vitamin D, probiotics, including spores. Thank you very much. All right. So I disagree with the handling you've had by your medical doctor. It's been my experience in my practice that many people with chronic Lyme have low white blood cells that is being caused by the chronic Lyme. So the Lyme germ in some people release chemicals that suppress the immune system. They make it so it doesn't respond as well. And in some people that can result in low white blood cells, okay? What I have found in my practice is that over time, as you get the Lyme germ under control with antibiotics, the white blood cells often will come back up on their own, all right? So even for this kind of a level, I would use antibiotics with you or herbal antibiotics, either way, prescription or herbal, and start treating you. And probably over time, what you would see is the white blood cells come up. I am not aware of any evidence that says low white blood cells is an indicator of cancer. So I'm not sure why your doctor is doing that. I mean, she may have some rationale. I'm not sure why your provider is doing that. And then, so I would start to treat with herbal or prescription antibiotics if you have Lyme. In terms of things that, so although I like the fact that you're thinking of zinc and vitamin D primarily, zinc and vitamin D, and the mold spores that might help boost your immune system, it's not clear that zinc and vitamin D and probiotics actually lead to increased levels of white blood cells. They do help them work more effectively, though, okay? I will tell you at a level that you have adequate blood cells. You have adequate white blood cells to fight infections. You still can fight them very well. So your zinc and your vitamin D and the spore-forming probiotics may lead to better functioning of those white blood cells, but there's no data that I have seen that says it leads to a greater production of white blood cells. What I know in my experience is getting the Lyme germs knocked down is sufficient to decrease the chemicals that those germs release that suppress your white blood cell production. Okay, that's been my experience here. All right. So again, I'm not aware of any cancers related to this kind of low white blood cells, and I'm not quite sure why your provider is testing for markers for that. Okay. All right. Good luck to you. Hello, Dave. Hi, Dr. Ross. I'm currently taking liposomal glutathione and ATP 360. Can ATP 360 turn my urine bright neon yellow? Also, do I need to stop taking these supplements prior and after getting the COVID Pfizer vaccine? Thank you. I haven't seen, and I've taken ATP 360 myself over time before too. So I speak personally, but also I speak just from experience of what I see with my patients. I'm not aware that it in most people gives yellow urine. Okay, now I think if you've participated in my webinars, you're going to know what the next thing I'm going to say you have heard me say before, which is there's a Marty Ross MD statement in medicine, or a rule of medicine, which is this: anything can happen to anyone with anything. All right. So there's common side effects that we have on prescriptions or herbal medicines. And then there are the atypical side effects we have that are just unique to us, mainly because our chemistries, everybody's chemistries in our bodies is a little bit different. Okay. So it could just be a side effect you're having, but I'm not aware of it being a typical side effect in people. Okay. In terms of one of the things I've been recommending, and I would say without science that says it's the right way to go, it's more based on theory, is that people, before they get the COVID vaccine, stop or decrease things that they are taking that might decrease cytokine production. Okay. And so here's the rationale behind that. So when you get the COVID vaccine, the immune system will respond to these spike proteins that somebody is making as a result of the COVID vaccine by making cytokines. And that actually, in this situation, is a good thing, okay? Because those cytokines are telling the other parts of the immune system to come in and develop white blood cells and antibodies and the ability to fight COVID, all right? So the cytokines, again, turn the immune system on, all right? My thoughts are on this, because I know cytokines can turn it on. Why would we want to have you on things that might turn them down? All right. Now, I have no science that proves that not being on things that lower cytokines makes a difference in the end effectiveness of the COVID vaccine. So even though I have suggested that people not be on things that lower cytokines like quercetin, like curcumin, like the product Cytoquel, like glutathione, there are times when I have patients that have done really poorly, for instance, with a surge in cytokines after the first vaccine, that I will tell them be on that stuff, okay? So I kind of individualize it. But, as a general with them, I'm trying to have people not be on anti-cytokine things beginning about a week before they get their vaccine through about 2 weeks after. But I will tell you, if you have a severe reaction, a cytokine reaction, on the COVID vaccine, then I am having some of my patients actually go back on those. Okay. All right. And so, yeah, glutathione would be one of those. Okay. All right. So again, 1 week before, and then you can resume them 2 weeks after. Okay. All right. Good luck to you, Dave. Hello, Mary. Hi, Dr. Ross. Have you had success with Naltrexone for chronic Lyme? If so, how long do you have to be on it to see improvement? So I have used and I do use quite a bit of low-dose Naltrexone in my practice. And in different situations, you get different results, okay? In terms of, so let me talk about it, and then I'm going to answer your specific question. So Naltrexone, everyone, is a narcotic blocker. So it's designed to help people with drug overdoses. That's what it was manufactured for. But we have found that it might be helpful in people that have immune-related disorders, and also in people that have myalgia pain, okay? Fibromyalgia pain or myalgia, excuse me, created by having Lyme in them as well too. All right, so how does something that's a narcotic overdose blocker help your immune system potentially work better and help with pain, given that it's a narcotic blocker? This doesn't seem to make sense, so let's talk about that. So our body, we ourselves manufacture a type of a narcotic called an endorphin. All right. So our bodies, we have cells in our bodies that manufacture chemicals called endorphins. And the endorphins that we manufacture do a number of things. One is they regulate the immune system. Okay. And the other thing that they do, they can help with pain. And so those are the two big things that they do. All right. Now, the idea with Naltrexone is if you take it and it blocks your endorphin receptors, there's a couple of things that happen. Number one, the brain doesn't like seeing that endorphin receptors are blocked in the body. and it starts sending out signals to the endorphin producing cells to make a lot more endorphins to overrun the blockade. Second thing that happens is these endorphin receptors become super sensitized. They become more sensitive to any of the remaining endorphins that are out there, okay? Now, the reason we use low-dose naltrexone and not full-strength naltrexone is full-strength naltrexone is a 50 milligram pill. That's how it's manufactured. We have it mixed up, so you take somewhere between 1.5 and 4.5 milligrams, which is why we call it low dose, okay? And the reason we go low dose is we want these receptors only to be blocked temporarily. And then that dosage range of about 1.5 to 4.5 milligrams, it's a temporary blockage that lasts maybe about 4 to 6 hours. Once the blockage wears off, these receptors are then flooded by all of the extra endorphins that have been made. And they're also super sensitive to those endorphins, so they respond even stronger too, okay? So in terms of immune regulation, what happens is this results in a better effectiveness of a type of white blood cell called T regulator cells. T regulator cells are what regulate the levels of what's called Th1 and Th2 inflammation. I know there's a lot of T's here, okay? So there's these cells called T regulators, and they manage a bunch of cells involved in inflammation related to infection. That's called Th1 inflammation. And they manage a bunch of cells that regulate antibody inflammation and allergy inflammation. That's called Th2 inflammation, all right? If these get out of balance, you can have immune dysfunction. The T regulators are in charge of keeping balance here, all right? So with LDN, you get better regulation of the T regulators, and therefore you get balance between Th1 and Th2, okay? That's one thing it does. Second thing, naltrexone binds in the brain to a type of cell called a microglia. Microglia are immune cells that are in the brain. And there's a receptor on microglia, which is known as a toll receptor. And if it gets blocked by the naltrexone, it will alter pain transmission and has been found to be very helpful in fibromyalgia. There's studies that show it's useful in fibromyalgia pain. And also it's been found to be helpful in the myalgia type pain, or I see it as being helpful in the myalgia type pain that people get with Lyme. Okay, now, in terms of conditions where I see the most potential benefit of help is if you have a type of Lyme that has triggered autoimmune illness like lupus or Sjogren's disease or rheumatoid arthritis that has been triggered by your Lyme, I especially in those kind of situations find low-dose naltrexone to be helpful. I find it to be helpful in situations where people have a lot of myalgia, all right? In terms of whether it is useful in regulating the immune system in a way that it helps you with your Lyme, I think the jury's out on that. If I have somebody that has, I will sometimes use low-dose naltrexone in somebody that we've tried all kinds of things to get their germs under control and that we're still not helping them much. I might add in low-dose naltrexone to try to regulate the immune system to get it working better so that they can get over the infection. In those kind of situations where there's not lupus or rheumatoid arthritis, any of those kind of immune disorders, I find it helpful maybe 20 or 30% of the time, okay? If you have a rheumatologic disorder with your Lyme, like lupus or rheumatoid arthritis or scleroderma, any of those, I find it helpful quite often, okay? And in situations where you have a lot of myalgia pain, I find it helpful maybe about 50 or 60% of the time. All right, how long do you use it for? Which was your question. I apologize for taking so long to get to it, but I wanted to make sure that everyone was on the same page in terms of how this stuff works, okay? It typically takes about 6 months to know if it is or is not going to work. When I first started working with it, I was using it for maybe about 3 or 4 months, and that was it. But I went to a conference a few years ago that had a whole module about low-dose naltrexone in it. And what I learned is that a lot of my colleagues were saying that they're seeing better benefits if you go at least 6 months, okay? So I started doing that in my practice. That's what I tend to see. I think you got to give it about 6 months to know if it's going to make any difference or not, okay? The way you start it usually is at about 1.5 milligrams one time a day. After 2 weeks, we bring it up to 3 milligrams, and 2 weeks later, we bring it up to 4.5 milligrams. That's a standard way that many of us will start it. I tend to have people take it in the morning because if you take it at night, in many people, it leads to sleep disruption, okay? In Europe, they tend to use it all in the morning. That's how they historically have done it. In the United States, many doctors have tended to use it at nighttime. And the reason they've tended to use it at nighttime is at night, before you go to bed, there's a natural occurrence where your body starts producing more endorphins at nighttime. So they use it at nighttime in the hope that you can even get a bigger surge in the nighttime endorphin surge, basically, okay? But the reality is it works as well whether you use it in the morning or at night. And because of the sleep disturbance potential, I tend to have people use it in the morning. Side effects you can get sometimes can be abdominal cramping. Rarely it can create some brain fog and confusion and even hallucinations. Generally, it's very well tolerated by most people, okay? It has to be made by a compounding pharmacy, all right? So if you want more information, because I know I just said a lot of stuff there, but if you want to read about this, let me show you the article I've written about this that you can take a look at. All right, so take a look in my online Lyme guide here and take a look at my immune system chapter here. And this is my article on low-dose naltrexone, all right? All right, very good. Good luck to you, Mary. I'm sorry for such a long-winded answer. I could have just said 6 months, but then everyone else wouldn't know what low-dose naltrexone is about. And maybe you've learned a few things about what it's supposed to do here as well, too. Okay. Hello, Marie E. Let's see. Hello again, I should say. Hi, Dr. Ross. I found a new practitioner to help me out with Lyme here in Quebec. A chiropractor who also studied functional medicine, neurology. She uses applied kinesiology. She treats one infection at a time. What do you think about treating one infection at a time? Babesia seems to be the first infection, and artemisinin, some homeopathy, and the thymus extract is what test as a treatment. I told her what I had read and heard about artemisinin. If we don't pulse it, it might not be effective. Because she tests, muscle tests every month, if the herb is still what's appropriate and might adapt and change depending on testing, she doesn't think pulsing is appropriate. But I have doubts. Any comments about this? Thank you. Boy, you're in a tough position, Marie, because the problem is anyone actually in Canada is in a tough position because your medical authorities up there basically persecute your doctors that treat Lyme. And so therefore many people don't treat Lyme up there. So it's very hard to find practitioners that are willing to go there. And unfortunately, some of the ones that do try to treat it don't know what they're doing. And that's what I would say here. So when it comes to treating Lyme, many of us that treat Lyme have found that when you have co-infections, to get co-infections and Lyme under control, you need to treat them both at the same time, at least two of them at the same time, okay, number one. Number two, kinesiology, it all depends on who the person is as to whether they're accurate at doing it. So for instance, although I've talked about Dr. Klinghardt here tonight, and I've said I have questions about some of his theories, one thing Dr. Klinghardt is good at doing is he uses a type of kinesiology called ART testing, and he developed the system. And he's spot on. I mean, I've seen some good results about what his testing says should be effective in a person, and then he uses it based on the testing. I think he does a good job. He has trained a lot of physicians, mainly naturopathic physicians out here in the Washington State area, in his technique. And a lot of them, I just don't think do a good job. I don't think they have the same touch that Dr. Klinghardt does at his technique. There's some that do. There's a few out here that I would use as an alternative to Dr. Klinghardt for that technique, but the majority don't. So a lot of what your tester is doing, I call them testers when they do kinesiology, it all depends on how good your tester is. And I don't know who your person is, okay? But generally, I find it best to treat for two. If you have two or more co-infections, I find it better to treat for at least two at a time, number one. Number two, when it comes to artemisinin, he doesn't understand what's happening with artemisinin. The problem with artemisinin is your liver develops an enzyme that will deactivate artemisinin probably after about 3 or 4 days. Okay, so it starts being destroyed within the body and doesn't leave enough levels to be absorbed to be active in the body. Now, his testing may still show artemisinin to be an effective agent, but that doesn't mean you're able to develop high enough levels in the blood to do anything if you take it day after day after day. Okay, so the reason I pulse my doses on it is I hit a person with high doses for 3 days and then have them stop to try to avoid getting into a period where the liver makes enzymes that destroys the stuff, basically. Okay, and so I don't think your practitioner understands that. So yeah, his testing may still show that artemisinin is effective, but the problem is that doesn't mean you're getting enough of it in you to be effective, okay, because your liver may be destroying it. All right. Second, the last point I would make too is you have to be careful about artemisinin these days. So on the East Coast of the United States, and you know, being in Quebec, you're kind of getting more towards the East Coast of your country, right? I would call it Quebec East Coast as well too. What we're seeing on the East Coast of the States, and I don't have as much experience with numbers of people that I have treated from Quebec and Nova Scotia, the Maritimes, along with Quebec, to know if this is so within the East Coast of Canada as well too. But in the East Coast of the United States, what we're seeing is artemisinin just doesn't seem to be that effective for people that have babesia, okay? So by proximity, because you're just over the border, north on the East Coast there, I would suspect you probably have a lot of babesia that's resistant to artemisinin there too, okay? So anyway, those are my thoughts. It's a difficult situation you're in because it's hard to find people to treat it up in your country. All right, good luck to you. Hello, Geraldine. Let's see. Are the essential oil recommended, such as cinnamon, clove, oregano, be used with herbals such as cat's claw, toba bark, Japanese knotweed, and cryptolepis? The answer is yeah. I do use them sometimes with those kind of combinations. Okay. All right. Good luck to you, Geraldine. Hello, Sarah. Let's see. Hello, Dr. Ross. Are you able to treat patients with ALDH2 deficiency with disulfiram? If so, is there any supplementation needed to help them? Thank you so much. Honestly, don't know. I would have to look into that. I honestly don't know off the top of my head. All right. Sorry about that, Sarah. Hello, Tammy. Let's see. Hi, Dr. Ross. Thank you for hosting this webinar. You're welcome. Hold on here just a minute. Let's see. Thank you for hosting these webinars. I started my 16-year-old son on Capri Plus by Karuna 13 days ago and titrated up to 2 pills 2 times daily to treat Candida in his gut. He also takes orthomolecular orthobiotic probiotic, which has 3 billion Saccharomyces boulardii in it. The Capri Plus is making him smell strongly of garlic. Also, the past 2 days, he has been having loose stools, which I'm not sure is being caused by the Capri Plus. Are these common side effects? I chose Capri Plus rather than Phytostan because of the concern of calcium interacting with the Bartonella antibiotics. I would like to treat him with an herbal instead of nystatin or antibiotics. Would Thorn SF2222, along with the probiotic, be able to replace the Capri Plus and still be as effective at treating Candida? If so, what dose of the SF7222 do you recommend? Got a lot of numbers there. Okay, so the Capri Plus, everyone, is a product made by Karuna that has in it caprylic acid. It also has garlic and it has oregano in it, okay? All of those can be effective at treating yeast. In general, it is not a type of garlic that gives people a strong smell. Occasionally it does. So probably the garlicky smell is coming from the Capri Plus, okay? I have not seen it on a regular basis give loose stools, but as you heard me mention tonight, anything can happen to anyone. So it's possible it's giving him the loose stools, all right? Now, at 16 years of age, that dose is a reasonable dose to consider using with him, 2 pills, 2 times a day. That's reasonable for his size that you would want to use that, okay? So if it's got side effects that are not tolerable to you, and that's what it sounds like here, you might want to look at an alternative, okay? An alternative you could look at the SF7222 by Thorne. It has a single ingredient in it called, I think, indolacinic acid. And that is something that can be effective on its own at treating yeast. I would give a product like a Capri Plus that has multiple avenues at treating this a little bit greater chance that it would work, though, okay? But I understand he can't take it. He's having a hard time, okay? So I want to look, I'm going to do a quick screen share here because I want to look at some other alternative products for you. The Phytostan, actually, I would be surprised if you actually found somebody that even has it in stock these days, but the last time I tried to order, which was last week, it was still out of stock. The producer has lost its ability to manufacture it right now, unless they may have finally found some. Anyhow, let me do a quick screen share here. Okay, so I'm gonna, I have to remind myself exactly. I think the Thorne is just the one item that's in it. So hold on here just a minute. So Thorne SF7222. Yeah, okay, so it's got the undecanoic acid in it, okay, so that could be good, but again, the problem with it is usually when we herbally, we want to use a compound that has multiple avenues in killing. This only has one, okay? All right, so another option to look at that you could take a look at is now, and I'm going to look at this with you because I got to remember what's in it, but Now brand as a Candida support supplement. And I think it's called Candida Support. Okay, and what that is available in, so what that has got in it is, oh, I see, it's got the magnesium that you're worried about. Okay. So it has magnesium, but it has caprylic acid, powder coal, black walnut, and oregano, okay? So this is something to consider. I'm going to go off screen share here, and even though you have concerns about magnesium, let me talk about that real quick. And yeah, if you were to do this, I would do this product as 2 pills twice a day, okay? All right, so the magnesium concern that you have. So magnesium will interfere with the absorption of 2 antibiotics that we tend to use in Lyme. And just 2. None of the other ones, just these 2. Azithromycin, clarithromycin. Azithromax, clarithromycin is Biaxin, okay? The thing about it, you just don't want to take them at the same time as those, okay? So if you're doing azithromycin, which is 1 time a day, you could take your azithromycin in the middle of the day and take your magnesium-containing yeast killer in the morning and at nighttime, for instance, okay? Or you could separate them. You just don't want to take them directly at the same time as an azithromycin or a clarithromycin. Separate them by at least an hour. That's going to give you enough time so that it doesn't interfere with the absorption of the clarithromycin or azithromycin. In terms of other antibiotics that we use, like the tetracyclines, doxycycline, minocycline, like Bactrim, like rifampin or rifabutin, the magnesium isn't really going to interfere with the absorption of those, okay? All right, I hope that gives you some ideas. Good luck to you, Tammy. Hello, James. Let's see. Oh, we answered that one earlier. Hello, Margaret. When you suddenly start seeing striae, does that mean your Bartonella is flaring up? It could. So striae, everyone, is a stretch mark type of rash that occurs. Now, they can occur in Bartonella. They also can occur if you've had rapid changes in your weight, okay? They also can occur if you're on somebody that is on steroids, okay? So anyhow, with those kind of caveats, if you have not had recent weight gain or weight loss and you're getting a lot of striae showing up, then yeah, it could be an indicator that Bartonella is active, unfortunately, okay? All right. Good luck to you, Margaret. Hello, June. Let's see. Thanks for this webinar. You're welcome. Any suggestions for somebody with multisusceptible genes who has Lyme, Bartonella, and Babesia? Will it make treatment harder? Thank you. Okay. So, June, I think what you're saying is that you've had a type of test called an HLA-DR test, which looks to see if you have a genetic profile that might make it difficult for you to remove toxins from mold and also possibly toxins from Lyme. I think that's what you mean when you say multi-susceptible. It means you're susceptible to toxin problems from Lyme and toxin problems from mold, okay? Now, keep in mind, that's a genetic profile test. And your genetics are basically your programming. It's your computer code, okay, that determines how you run. But how you're coded does not necessarily always manifest as a problem, all right? Because our bodies also have multiple mechanisms to fix problems that might have genetic code errors, okay? So for instance, in the bacteria in our gut, if we look at the genetic profile of us, about 90% of the genetic material that is found in a human is actually from the bacteria in our gut, right? We let all these bacteria exist in us for some reason, all right? And one of the things that we're probably getting out of these bacteria, well, there's a number of things we get. They aid in digestion, they can remove toxins, they make chemicals to help our brain work better, they release chemicals to help the immune system work better. So these bacteria in our gut, the gut microbiome is like a whole separate organ system in the body, all right? But one of the things that they can do is they can make chemicals that might be missing if we're programmed genetically incorrect. So they might make signals that help your immune system remove toxins, even though the genetic code to remove mold or Lyme toxins isn't correct for that, okay? So I just want to caution you that having the genetic code for a problem does not necessarily mean you're going to develop the problem, okay? So number one, okay? Number two, the best way to find out if you actually have a mold toxin problem is not the genetic profile testing. It's to actually see, do you have a mold toxin problem, all right? And that is to measure mold toxins that are in you. So that requires doing a urine test. And I like using either a lab in Texas called Real Time Labs. They have a urine mycotoxin test. I think that's probably the most reliable test we have out there. As an alternative, Great Plains in Kansas does one that is okay. I mean, it's pretty good, but I think the more reliable one is Real Time. And then more recently, a lab called Vibrant Labs here in the States has been doing the testing. The trouble is Vibrant hasn't verified that their test is actually effective, even though everyone's out there doing it, okay? So I don't know what the meaning of a Vibrant lab is for anything that they do, other than their Lyme microarray test. They have done validation studies. They haven't validated any of their other testing, though, okay? So anyhow, one thing to see if you have a problem from this genetic profile is for the test to see if you have mold toxins in you, okay? But having this susceptibility, I don't think makes it any more difficult to get Lyme or Bartonella out of you. The one thing I would want to do with this kind of profile is make sure that you are on some binders to bind up Lyme toxins, at least in your intestines. And if you're doing that and trying to remove them and are removing them, then probably the rest of your treatment should go okay. I don't think it makes it any more difficult for you with this kind of a genetic profile, okay? So what would I use with this kind of a setup? I might have somebody take something called a product called GI Detox that has in it clay. It's also got charcoal, some humic acid, fulvic acid, some silica in it. These are things that bind toxins. I might do one a day, maybe two, one time a day, are some things I might consider doing, okay? Anyhow, those are some thoughts for you. I would talk to your healthcare provider about this as well, too, the person that did this kind of testing, and see what ideas they have as well, okay? All right. Good luck to you, June. Hello, Geraldine. Let's see, I'm a little bit confused about persister Lyme. Are the round cysts the persisters? Okay, so I tried to address this earlier tonight. I'm not sure if you were in the room when I already talked about this, but let's talk about it again, because this gets very confusing, okay? So remember, 4 years ago, we discovered that, maybe 5 years ago now, the Northeastern University in Boston conducted some studies which showed us for the first time that Lyme has two different growth states: growing forms and hibernating forms, which are also called persisters, okay? All right. So before that, all that we knew we had were growing forms. And the growing forms we knew existed in, or the growing state had two forms. Those forms were spirochetes and cysts, which are also known as round bodies, okay? And spirochetes can morph into cysts or round bodies, and round bodies and cysts can morph into spirochetes, okay? Right. Now, what we now know is that these spirochetes and the cyst have two different growth states. Okay, so there are growing spirochetes, there are growing cysts. Okay, and then there are hibernating cysts and hibernating spirochetes, and those hibernators are called persisters. Okay, so I hope that clears it up for you. Hi, Eric. Hi, Marty. Let's see. I've been reading your anti-germ action plans. I have used burner herbs for the past year. Many symptoms have improved, but arthritis is worse, and I need to do something more. Thank you so much for publishing this very helpful guide. You're welcome. I'm trying to get a local doctor to work with me on treatment, though his knowledge is limited about Lyme disease. I wanted to start possibly with the macrolide plus azole combination, clarithromycin 500 milligrams 2 times a day, and tinidazole 500 milligrams 1 pill 2 or 3 times a day. Do you typically do a cycle with this combo 3 days on and 4 days off, or is this one just full-time all days of the week? Also, what is the maximum time I should take this combo if I seem to be able to handle it? I'm doing all your detox recommendations following the first 10 steps of the Ross Lyme Support Protocol. All right, very good. Eric, I'm glad you're finding it helpful. And so let me try to clarify that part of your question here. So when I use the clarithromycin along with tinidazole, what I'd like to do is take the clarithromycin daily, every day. And that's 1 pill 2 times a day. The tinidazole, I will pulse. I'll have a person take it for 4 days on and 3 days off, okay? Primary reason that I do that is it provides less stress to the liver, and it works really well, okay? So that's how I would wind up going about doing that. I usually will use that kind of a combination for up to 6 months. If you're getting some help out of it, you probably will start noticing something within about 3 months of being on it, okay? On the tinidazole, I would make sure that your practitioner, after the first month, checks your liver function with blood testing to make sure the liver is handling it okay. If everything looks good after the first month, you probably can switch out to doing liver testing about every 2 months, okay? So everyone, clarithromycin is useful at treating the spirochete form. Tinidazole probably can treat Lyme that lives inside of cells. Clarithromycin can treat Lyme that lives inside of cells too. And the tinidazole is a great cyst buster. It treats the round forms of the cyst forms of the germ. Okay. All right. And so that's why you would wind up using that. All right. Good luck to you. Hello, Chris. Let's see. Hello, Dr. Ross. Thank you for all you do. You're welcome. I have a question surrounding current COVID vaccines that are available and which one would be best given this situation. The Pfizer Moderna mRNA vaccines contain PEG, which I have a severe reaction to, getting sick, throwing up, severe nausea, etc. But the Johnson & Johnson vaccine have been linked to possible blood clotting, and I am at risk. Severe migraines, swelling in lower legs and feet. Any suggestions? Thank you. So first of all, I'm not your doctor. Okay, so these are ideas that you should ultimately talk with your physician about. Okay, so I just want you to know that because I don't know enough more details about your health history. Okay, but based just on what you said there, I would look at probably going with the Johnson & Johnson. So we know you're going to have an acute reaction because of the PEG and the Pfizer and Moderna, all right? In terms of blood clotting, it appears that this blood clotting issue is an issue in young women and probably is related to a genetic deficiency or a rare genetic issue, and has something to do probably with hormones and the genetic issue and the Johnson & Johnson. So it is something that's occurring in women, not in men, okay? And so my sense would be probably you'd be okay with the Johnson & Johnson. However, this is something you should talk to your physician about to get their take on it as well, too, okay? All right. Good luck to you, Chris. Lisa, thank you for your comment. Lisa just said, thank you for all you do. I appreciate that. Thank you. Hello, Barbara. Dear Dr. Ross, thank you for all you do. Wish you were not so far away, writing from the East Coast. Question on COVID immunization. I got the first vaccine on May 1, Pfizer. Developed high blood pressure and would like to settle down again before daring the second vaccine. How long can one stretch the interim time? I can't find any recommendations other than the second is mandatory. Thank you very much. Okay. So let me just make a few comments. And a lot of this is evolving science, okay? So CDC, as many of you know, last week, changed its guidance to basically say that that based on their own research, now that we've been using COVID vaccines for a while, not based on the research that was submitted to get approval of the vaccines, but rather based on the experience we've seen over the last months as this has been used. And what their research showed is, number one, people that are vaccinated, even if they were to get exposed and have a small amount of the virus get in their nose, they're not going to spread it. Okay, so that has created some controversy because now people are concerned that everyone's unmasking too early. But basically, people that their research showed that if you're vaccinated, you're not going to spread it. Oops. Siri just said she's sorry. Anyhow, I don't know how that happened. But anyhow, so one of the things that was discovered in this research is if you're vaccinated, you're not going to get it and you're not going to spread it, basically. Okay. Second thing that was shown is that the vaccines are actually, in practice, are as effective as the manufacturer suggested they would be. And that is they both, Moderna and the Pfizer, seem to be effective about 95% of the time. So in the real world, working with the day-to-day, these are 95% effective, okay? But also in that research, they looked at what was the effectiveness of the single dose of the Pfizer or the Moderna vaccine. And they found it's about 85%. I think it's 80 to 85% effective. Just getting one dose is 80 to 85% effective. That's pretty good, okay? So anyway, I just want to let you know, even if you have to stretch it, it's still going to be effective. Now, what is interesting is in Canada, they have taken a different stance. The public health authorities there have taken a different viewpoint than what we've done with our public health authorities here in the States. In Canada, their priority has been to get one dose into everyone as quickly as possible, and to delay giving the second dose so they can prioritize getting everyone one dose. Okay. Now that makes sense. If one dose gets you 85% vaccinated, that's a good idea. You want to get as many doses as you can out there, especially if you don't have the availability of the vaccine like the way we do here in the States. They don't have it as available up in Canada. All right. So the reason I'm saying all this is to delay, you're still going to have some good immunity, even if you have to delay. Originally, with the Pfizer vaccine, they were saying ideally, you want to get it at 3 weeks. But I would have to say, I don't think we know for sure. I don't think anyone has actually researched what happens if you delay to 6 weeks, or you delay to 8 weeks, or you delay to 12 weeks. What I want to let you know is you probably still have some immunity, basically. Okay. So how long can one stretch out? I don't know. What I would let you know is that you probably have some good effectiveness of the vaccine just with getting one shot. And yeah. All right. So yeah, there you go. Good luck to you, Barbara. Hello, Judy. Hold on here just a minute. Regarding methylene blue, what drug or food interactions do you advise your patients about when you prescribe methylene blue for BART treatment, other than SSRIs and other meds that affect serotonin? Started my first dose of 25 milligrams a few days ago and had a small but noticeable bump in energy and brain clarity the following day. Took my second dose and was all okay until the following morning when I woke up and got very nauseated after drinking coffee. I actually threw up, which is very unusual for me. Do you tell patients to avoid caffeine? What about allergy medicines? This felt more like a drug reaction or interaction and not a Herx reaction. Thank you. So, Judy, the main thing is just what you mentioned. Is I tell people that if they're on antidepressant medicines that can raise serotonin, I'm a bit more cautious about using it, but I still use it. Okay. If they're on super high doses of those antidepressant medicines, I may not use the methylene blue. All right. All right. The other thing I will do as a caution is to do a blood test to make sure that they have adequate levels of an antioxidant in their red blood cells called G6PD, which stands for glucose 6-phosphate dehydrogenase. You want to make sure you have enough of that antioxidant, because if you don't and you take methylene blue, it could cause a rupture, hemolysis of your red blood cells. All right, so that's the other precaution I take. All right. In terms of side effects that I am seeing an occasional person that does get bladder irritation from being on it. I have had one person that developed allergic reaction to it with hives. And I've seen people get some pretty significant Herx reactions on it, okay? What you have just described here, though, is none of those, all right? This sounds like an atypical side effect you had that I don't know if it was related to the caffeine or not. I, in my practice, don't have people restrict their foods or make any diet changes when they're on methylene blue, and 99% of people are tolerating methylene blue fine. I've had to have one person stop it because of allergies, okay? That's the only person I've had to have stop. I've had to have people lower doses because of significant Herx reactions. I have had a few people that have had some bladder irritation from it, but that's about it, all right? I would think this was something. It could be that it was your throwing up may have another cause to it. It may not be related to the methylene blue. It could be, but it may not be. Maybe you were just going to get nausea anyhow. Okay, so those are my thoughts for you. Okay, all right. Good luck to you, Judy. Hello, Marilyn. Let's see. Thank you for helping all of us. You're welcome. I treat patients with Lyme mold. Can you treat this without antibiotics? Um, so you can treat mold toxicity without antibiotics, okay? And there are some people that if I think the predominant cause of their illness is mold toxicity, even if they have Lyme, there are times that I've been able to treat just by using binders and dealing with the mold toxicity, and they get all the way well, and we never give them anything for Lyme. Now, that's a rare thing that happens, but I have had that happen, okay? But generally, if Lyme is active and the immune system is not able to handle it, you're going to wind up having to give something to kill the Lyme. That just is generally, okay? So for instance, many of you may have heard this story from listening to my webinars. I had a guy that came to see me about 4 years ago that had seen one of the physicians, a naturopath here in town that treats tick-borne illnesses, that just totally missed the fact that he was loaded with mold. He had a very positive Lyme Western blot test, severe cognitive impairment. He had so much fatigue and cognitive impairment that he had lost his job, had lost his wife, had lost his kids. Things were really desperate. His mom came in with him. His mom's a nurse, brought him in and had to interpret a lot of stuff for him. I mean, he couldn't comprehend anything practically too. But what I gathered in his story is, and he had been sent, they came into me because the naturopath that was treating them had scared them into believing that they had to rush and get on IV antibiotics or his brain was going to be permanently injured because he had positive Lyme test, okay, and he had all these symptoms. So what I do in my first visits, I always try to figure out what came first. And so what I gathered from him is he was healthy. He had no health problems. And then he moved into a house that was full of mold. And then he got sick. So yeah, he had a positive Lyme test. He had symptoms that looked like Lyme, but it was the mold that got him sick. So what I did is I went after the mold first. And we got a urine mycotoxin test. He came back loaded with mycotoxins. I spent 3 months cleaning him out, and he got about 80% better. We spent about another 3 months cleaning him out, and he got 100% well. And we never did anything to treat his Lyme germs. Nothing. Because in the end, I don't think it was Lyme that was causing his problem. I think it was mold toxicity. I think his immune system had dealt with the Lyme prior to that. Because sometimes our immune systems can't deal it. We don't have to give antibiotics to everyone that gets Lyme infections. Sometimes our immune systems are capable of dealing with it. Okay? All right. Thanks for that question, Marilyn. Good luck to you. Hello, Lynn. Let's see. Hi, Dr. Ross. I've been symptom-free. Oops, we answered that one earlier. Hello, Marilyn. Let's see. If a patient has a low MSH, do you feel this plays a role with insomnia, adrenal fatigue, and hormone imbalance? It could. There may be many other factors going on, though, too. And so to answer this one all the way, I'd have to ask a lot of questions. Okay. All right. Good luck to you, Marilyn. Hello, Lorraine. Let's see. Hello, Dr. Ross. How important is it to remove parasites to heal from Lyme? So I think I answered that one earlier tonight. As I said, if you have intestinal parasites, yes. If I do not believe in this idea perpetuated by Dr. Klinghardt, and which has currently become a very fad idea on the internet, that everyone that's not getting better from Lyme has parasites within their blood and throughout the body. Okay, I don't agree. There's no science that supports that at all. So generally, for most people, I don't think they have to do anything about parasites. Okay, all right. Thanks for that question. If you missed the response from earlier, listen to the recording. It was near the beginning of the recording tonight that I talked extensively about my feelings about Dr. Klinghardt's ideas and parasites. I think it's garbage. I just do not buy the idea at all. Okay? All right. Thanks, Lorraine. Hello, Charlene. Hi, Dr. Ross. I received an email from Hopkinton Compounding Pharmacy saying that they had liposomal rifabutin, liposomal ceftazidime for the Lyme customers. What what do they do for Lyme? As always, thank you. Hope you are taking a vacation this summer. Thanks, Charlene Dixon. Charlene, I wish I was taking a vacation this summer. Unfortunately, fortunately, my longtime receptionist, who's been with me through the years, through thick and thin, I trust her as kind of my right hand around here running this place. She got pregnant. So, and I'm very glad for her, but it's created a little bit of a disruption for me because she's going to be leaving on pregnancy leave, and I'm going to have a temporary employee in. And during that time period, I want to be here because I only have one employee that works for me. I actually run my office with just one staff person. So anyhow, I need to be around this whole summer while she's gone. And I think she's coming back in September. And at that point, I plan on taking a 10-day motorcycle trip down the Oregon coast into Northern California. But until then, I'm going to be bound here, I'm afraid. So anyhow, thank you for asking. And I'm very glad for Christine and her having a new baby, but I am going to miss her. I trust what she does around here for me. So yeah. Anyhow, there's this. I know I like Hopkinton for some things, but I also don't fully know or agree that we need to be on all these liposomal products. Liposomal means that they're mixing these in fat. Okay, now. Some of the products that Hopkinton is calling liposomal is, I guess I would call it a misappropriation of the term. All right, so let me talk about this. All right, so what true liposomal products mean is that you microscopically wrap the medicine in little fat bubbles. Okay, so they're inside these fat bubbles. And what that can do is increase the absorption of a medication. But some companies, when they use the word liposomal, what they're really doing is they're just blending together fat and the medicine, which may or may not actually increase its absorption. Okay, so number one, and that's what a lot of these liposomal products are. They're coming out of Hopkinton and coming out of a lot of other places too. Okay. Now, there are times I do think mixing medicines with fat, like the liposomal methylene blue they have, yeah, that increases the absorption. But I don't know that it really does with rifabutin and ceftazidime. And for the average person, you got good absorption of these medicines anyhow. I don't know what real advantages we're getting out of using liposomal products for the average medicine. Okay, now, glutathione, yeah, having liposomal glutathione makes a lot of sense because it's horribly absorbed. And there's good studies, for instance, with the glutathione product made by Research Nutritionals, which is a true liposomal product. They've got great studies showing increased absorption and getting it into the cells. Okay, great studies showing that. Okay, so in certain situations, yeah, it makes sense. Methylene blue, it's a very fat soluble medicine, and you do get increased absorption of it if you blend it with oil. That makes sense. All right, but some of these other medicines just doesn't make sense, and I haven't seen anything that helps me understand why we're suddenly making liposomal rifabutin and ceftazidime. Those have pretty good absorption on their own. Okay, all right. Thanks, Charlene. Good luck to you. Hello, Lisa. Let's see. Been on antibiotics for a year, off and on. Was on dapsone and red blood cell count went too low after a year. I stopped my last round of antibiotics 3 weeks ago. I can't detox, but feel them having a party in my brain and heart. I do have babesiosis and Lyme. Mold is an issue also. Now, I'm trying to see if there's a question with that. Lisa, I'm not sure what the question is. I understand you've had a difficult time here, but I don't know what your question is. So I'm sorry, I don't have an answer there. Hello, Marilyn C. Do you see low HCl in the gut with Lyme, mold, or parasites? Not that I'm aware of. All right. Could be. I'm just not aware of it. Hello, Alex. Let's see. Good evening, Dr. Ross. What do you think of pyrimethamine as a biofilm breaker? Is there any other approach that target biofilm the way that Daraprim does? I'm looking for an alternative. Thank you. So first of all, I'm not aware of Daraprim as a biofilm breaker that I've ever used in my practice. I haven't used it, and I haven't seen the studies about it. Okay. What I like using, the oils like oregano and clove and cinnamon can be biofilm breakers. I like using, for the Lyme germ, I like using Otoba and cat's claw. I like using another product called Biocidin, which has a lot of herbs and methods in it to break up biofilms. Those are the things I tend to use, but I don't have enough information to compare it to the Daraprim. Okay. All right. If you want information about this Biocidin that I was just telling you, or what I use to break up biofilms, let me just do a quick screen share here for you. So take a look at my section in the online Lyme guide called Biofilms. And I describe this Biocidin right here. It's one of the things you could use. But I lay out other ideas here in this article called Biofilms, Lyme Disease Gated Communities. Okay, I list a number of products in here as well too. The only thing that's not included in here is information about the oils that I was just describing to you, okay? And the Otoba bark and cat's claw is really good biofilm breaker for Lyme. I like using lumbar kinase sometimes too. Stevia, which is here, generally has been a failure. Even though laboratory experiments showed it might be useful, reality is I just don't find it useful at all. And that's what I say in this article as well too. But anyhow, those are some things you probably have heard about. All right, good luck to you, Alex. Hello, Heidi. Let's see. Hello, Dr. Ross. Thank you for all you do. You're welcome. I'm curious if you can tell me which herbs, supplements, etc., are safe to use during pregnancy to treat Lyme and Bartonella. Also, is any amount, okay, so first question, there are no studies that say they are safe to use during pregnancy. I know Buhner talks, I believe, I forget what Buhner is recommended. I think that Cryptolepis may be safe, but anyhow, there's no studies that prove safety, so I don't use them. So to answer that question. Also, is any amount of far infrared sauna safe to do while pregnant? I've been dealing with Lyme, co-infections, parasites, chronic HSV, panic disorder, mold toxicity for 13 years. Within the last year, my naturopath and I have done much testing and corresponding treatments, and there has been major headway, but we're still working with Lyme and Bartonella. I'm currently taking oregano oil, cystis, BLT, herbal tincture of salvia, skullcap. My partner and I are hoping to start trying as soon as possible, as I'm in my late 30s, but I want to make sure to have resources on hand. Thank you. So what I would say is, Heidi, I'm of the school of thought, and maybe others have information that I'm not aware of, that these herbal medicines, there is not enough studies done to prove safety in pregnancy. And there aren't. Unless somebody can show me an article on it, they haven't been done. In these kind of situations, I tend to go with prescription antibiotics, even in people that want to use herbal, because at least with the prescription antibiotic methods of handling these infections, we have science that says there is safety in pregnancy. Okay. I know you don't want to hear that. People don't want to hear that, but I can understand that might be concerning. But yeah, those are my thoughts on that. Okay. All right. Good luck to you, Heidi. All right, everyone. That's it for me for tonight. I've had a good time being with you here tonight. I hope you all got some useful information, and there's some things that might help your treatments. So take a look tomorrow morning in your email, probably by around 9:30 in the morning. I should have this out, although last week I got it a little bit later, but I plan on getting it out in the morning for you, okay? And on that, I'll have a sign up for the next set of webinars. Now, it is possible I may be actually off for 2 weeks. We'll have to see. I've got a plan to go join my girlfriend, who is up in Alaska for her birthday, and I think that may be 2 Thursdays from now. But I have to look at my dates on that. And if it is, I'm traveling up there, and I won't be down here. So, anyhow, yeah. So, but take a look at it. You'll see there's a sign up tomorrow morning for the next set of webinars whenever I plan those, and but I'll have it figured out by tomorrow morning. When you get the email, I appreciate it if you would share the recording of these webinars and information about the webinars with those of you that might get, those people you know that have Lyme that might get benefit, okay? All right. So good night, everyone, and I look forward to seeing you in the future. Okay, good night.